Hello viewers, welcome to HMS Desk. Today, let's explore the world of total knee replacement surgery. Total knee replacement is a surgical procedure that involves replacing a damaged or worn-out knee joint with an artificial implant. It is a common procedure performed to alleviate pain, improve mobility, and enhance the quality of life for individuals with severe knee arthritis or joint damage. Here is a generalized step-by-step guide to the total knee replacement procedure. Preoperative evaluation. Before the surgery, you will undergo a comprehensive evaluation that may include a physical examination, imaging tests, such as X-rays or MRI, and medical history review. This helps the medical team assess the extent of knee damage and determine the most appropriate treatment approach. Anesthesia. Once in the operating room, you will be given anesthesia to ensure a pain-free experience during the surgery. The anesthesia options include general anesthesia, where you will be unconscious, or regional anesthesia, where the lower body is numbed while you remain awake. Incision. The surgeon will make an incision on the front of the knee, exposing the knee joint. Reshaping the bones. The damaged surfaces of the thigh bone, femur, shin bone, tibia, and kneecap, patella, are carefully reshaped using specialized surgical instruments to prepare them for the artificial components. Implant placement. The surgeon will secure the artificial components, which typically consist of metal and plastic, to the reshaped bone surfaces. The components may be cemented into place or have a porous surface that allows the bone to grow into them for stability. Knee stability and alignment. The surgeon will assess the knee's stability and ensure proper alignment of the components. This is crucial for achieving optimal function and longevity of the artificial joint. Wound closure. Once the components are in place, the surgeon will close the incision with stitches or staples. Sterile dressings or bandages will be applied to protect the surgical site. Post-operative recovery. You will be moved to the recovery room, where you will be closely monitored as you wake up from anesthesia. Pain management techniques, such as medication and ice therapy, will be utilized to ensure your comfort. Rehabilitation. After surgery, a comprehensive rehabilitation program will be initiated. Physical therapy will play a key role in helping you regain knee strength, flexibility, and mobility. The therapist will guide you through exercises and assistive techniques to facilitate your recovery. Follow-up care. Regular follow-up appointments will be scheduled to monitor your progress, assess the function of the new knee joint, and make any necessary adjustments to your rehabilitation plan. It is important to note that the total knee replacement procedure may vary slightly depending on the individual case and the surgeon's technique. At HMS Desk, we understand the importance of total knee replacement surgery and its impact on improving quality of life. Our experienced healthcare professionals work closely with renowned orthopedic surgeons and modern medical facilities to ensure world-class treatment and personalized care throughout the entire process. If you are considering total knee replacement surgery to relieve pain and regain mobility, don't hesitate to reach out to HMS Desk. We are dedicated to providing support, guidance, and access to exceptional healthcare services. For more information, visit our website at hmsdesk.com or email us at support@hmsdesk.com. Don't forget to subscribe, like, and share our channel to stay updated with the latest healthcare information. Thank you for watching, and we look forward to being a part of your journey to a pain-free and active life with total knee replacement surgery.